Good morning. I'll be given the humble duty of introducing what today is all about. We are standing on the cusp of a very pivotal point in history, in my opinion, in my humble opinion. There's a lot that's happening. There's a lot that's happening in isolation. What are these things that are happening? I'll talk about them briefly. One, a lot of effort has gone into creating an improved policy and regulatory environment that allows private enterprise to thrive, that allows businesses, including healthcare and non-healthcare businesses, to thrive. We as a country are leading in many ways in terms of creating the right climate for businesses to thrive. That is one thing that is happening. The other thing that is happening is we are seeing an unprecedented pipeline of innovations, including healthcare innovations that are pretty much transforming health services as we know them. Over the last year and a half or so, the COVID-19 pandemic has pushed the world to the brink of collapse pretty much at some point. Everything stopped. Things are bad when the airspace gets cleared because it basically means there's no global movement and trade. COVID got us there, but a lot of innovation, tech and non-tech innovation and solutions from public and private sector are slowly getting us back on track. So there's a massive, massive, massive opportunity that's coming with increased innovation, tech and non-tech innovation. All right? The third thing that is happening is research and academia is increasingly being asked to come out of its shell and participate in the conversations on how we can take this to the next level. We have a very traditional, we have a history of a very traditional academic sector that is pretty much locked in a lab. They exist in a cocoon of their own. So we have a lot of science, technology, and innovation happening, but it's happening in isolation from the policy changes that are creating a good environment and from the innovators in industry. Most of them don't even work within academia. They don't even, in their own words, they don't care too much about universities and academia. So what we have, ladies and gentlemen, is a schism that is costing us. It's taking away an opportunity at this pivotal point for us to give birth to a more improved world. Now, looking at this from the healthcare lenses, what does it mean? It basically means we need to spend more time doing things now and less time talking. How do we spend more time doing, translating innovation, thinking, research outputs, and maximizing the benefits from the improved climate? How do we spend more time doing that? It's simply by focusing on getting the right partnerships in place. I've mentioned the word PPP as I come to the end of my small introduction. What is a PPP? You need to go back in history to understand what a public-private partnership is. Historically, PPPs were designed or developed as a way of removing government involvement from the tedious and heavy task of constructing and delivering on infrastructure projects. That is the history of PPPs. The government needed to bother less about the doing and focus more on the customer or the community experience. The government needed to move from constructing the building to monitoring how it's being used, whether there's equity in how it's being used, are people accessing it well, are people being treated well when they access that building. That is the history of PPPs. Now, it's important that I share this with you because history favors heavy capital investment PPPs that are focused on infrastructure. PPPs were naturally never designed for health services in its raw form, and that is something that we need to recognize. So even as we start this conversation about making partnerships work, we need to know that and a lot of us have a keen interest in the healthcare space, we need to know that we are starting from a position of disadvantage. We are starting at a point where we need to define in a very organic way frameworks that work, but we don't have a lot of time for policy and rhetoric. We need to figure out how to get this in practice through immediate and constant engagement. And more importantly, we need the honest policy brokers who are going to help connect the ecosystem that I've said is extremely fragmented. Once we get this done, then policy, science, technology, and innovation, practice, and innovators, and including entrepreneurs who are working within the space, will be able to effectively define what is important from the community's perspective, not from the supply side. They'll be able to define what is important to our communities, and they'll be able to work together towards realizing that while being agnostic to the history, to the ownership of the different sectors. We need to move away from the cocoons, and we need to move towards an ecosystems approach to partnerships. Thank you very much.